Okay, so today we're going to discuss the new FCPath in Chemical Pathology, the Part 1 exam. We're going to look at the purpose of this exam, the level of training and knowledge that is going to be required to take this exam. And then I will also give you some suggestions for books and sources of material that you need to use to prepare for this exam, or rather that will put you in the best position to pass the exam if you use them. And then we'll look at the curriculum and the syllabus very briefly, but remember those documents are published on the college website, and we'll just look at them very briefly. And then we will look at some typical questions that may come up, or types of questions that may come up in the exam. Okay, so let's look at the examination document. If we look, and this is the document that's come off the college website. So it says that to write the exam, you need 12 months full-time training as a registrar, and it's coming into effect from January 2017. And if we go on further, the basic syllabus is the theory, principles, and practice of physiological chemistry, abnormal body chemistry, and then biochemical procedures. The Part 1 exam will have an overall pass mark of 50%, and there are 2 3-hour papers. Paper 1 is MCQs and short questions, and paper 2 is a mixture of cases, calculations, and OSPEs. Okay, so let's talk about the Part 1 paper, the first paper in the Part 1 exam. So, so this is going to be the theoretical part of the exam that's going to test the basic knowledge that a registrar has prior to becoming a senior registrar. So in other words, what the exam is trying to determine is whether the registrar, whether you as a registrar, if you are the candidate, whether you have acquired the basic knowledge that would put you in good stead to become a senior registrar. So the easiest way to explain what is required is probably to suggest that you need to, for example, have become very familiar with Marshall, for example, the Small Marshall. The Small Marshall is an excellent book. Okay, so let's look at the actual structure of the exam. So, or rather the blueprint of the Part 1 paper. So what you can see here, you've got paper 1 and you've got paper 2. Each one will last 3 hours, right? And then paper 1 will have MCQs or EMQs, extended matching questions. And we will discuss examples of those later on. And that will be 75 marks in total. And then you will have short answer questions, and we'll see examples of those later on, and that will be 75 marks in total. Paper 2, 3 hours. It will have cases, calculations, and OSPEs. The cases will be worth 50 marks. Calculations will be worth 50 marks. OSPEs will be worth 50 marks. In other words, a total of 150 marks. The cases will be 10 cases. They're basically the short types of cases, and we'll discuss the types of cases in more detail shortly. And those will have clinical and laboratory scenarios and questions. And those can be in the form of short answer questions or extended matching questions. And we'll discuss the format of extended matching questions shortly. Calculations, we'll discuss types of calculations that you can expect. And then the OSPE. Now, the OSPE is designed to test practical application of knowledge. Remember that because this exam does not have a practical component, this has to be tested in some way. In other words, to determine whether the candidate has actually been exposed to the lab. In other words, they understand some of the basic techniques in the lab, and they can deal with common lab scenarios. So that is basically the structure of the Part 1 exam. 2 papers, each with 3 hours. MCQs and short answer questions, so largely theoretical questions in the first paper. And paper 2 is more practical application because there are cases, there are calculations, and there are OSPEs. So this is the 8th edition, the latest edition of Marshall, and it's actually been published in 2017. I cannot recommend this book highly enough because I've used every edition of this book since it first came out, and even when, I'm not sure if it was around, yes, it was around when I was a registrar. So the book has been through many iterations. It's excellent. I recommend it to every registrar in their first year, and it's really it'll give you a good grounding in chemical pathology, as well as also prepare you for some of the other parts of the exam. So when we come to talk about the paper 2, the paper 2 has all these case scenarios case scenario questions in them. So in paper 2, the types of clinical scenarios that you're likely to get are the types of scenarios that will be similar or a similar standard to a book like Marshall. In other words, no one is trying to give you no one is attempting to give you a difficult clinical scenario, because this is a Part 1 exam. So the clinical scenarios will be typical clinical scenarios that are common, that you would expect a first-year registrar to be able to tackle for the exam. Now, given that I would say that most registrars would be ready for this exam after 18 months of training, even though the regulations say you can do it after 12 months. If it happens to be that you are of the caliber that you can do it after 12 months, then you are allowed to do it. But I think that in most instances, people will probably go through 18 months of training before they feel comfortable taking the exam. So coming back to the Part 1. So the paper 1 of the Part 1. So the paper 1 of the Part 1 is going to look at how you integrate basic biochemical knowledge with chemical pathology. In other words, with chemistry, how you interrelate basic biochemistry with chemical pathology or clinical chemistry. And this is because as you go further in your training, when you come to the Part 2 of the exam, examiners are less worried about how much basic biochemistry you know, because there's so many other things that need to be tested in chemical pathology, so there's less concern. So the expectation is that you would have done enough basic biochemistry in the first part of your training. Okay, so let's look at the actual syllabus of the exam. The syllabus or the curriculum is published on the college website. It should actually say Part 1 in this part here. So the curriculum for the Part 1 exam is a different document from the Part 2 exam. Not because they are different. It's just that to make it easier for junior registrars to be able to focus on what is important before they move on to the more difficult things. So that's why it's in a separate document. And you can see it covers all the things that you would eventually need to know as a senior registrar. Basic principles, laboratory safety, method evaluation, quality control, analytical techniques, chemistry automation, molecular techniques, and then I want to highlight the section on basic biochemistry. So as I've said before, biochemistry is going to be very important. And the candidate would need to know the biochemical pathways for the major systems in intermediary metabolism. They need to understand amino acids and proteins, and then also understand the biochemistry of many of the analytes, enzymes, carbohydrates, blood gases. Obviously, you can go through this at your leisure, and then obviously there's organ system function that needs to be covered. And the last section illustrates the recommended books that you are going to need, or you should be using, or the suggested books that would give you probably in most people's view the best position, or put you in the best position to tackle this exam. So I've mentioned clinical chemistry, what we call the Little Marshall, which is now in its 8th edition. So the one I've showed you is the 8th edition, the 2017 edition, and it's by Marshall, Lapsley and Day. And then if you've got any good undergraduate notes, those are also recommended. Now, the next issue is, how do you tackle all the technical and operational knowledge that you are going to require? And so for this purpose, there are a couple of books that you need to become familiar with. Either of these, the one is Clinical Chemistry, Principles, Techniques, and Correlations by Bishop, or Teet's Fundamentals of Clinical Chemistry. Now, my recommendation at this point in time would not be for a senior registrar to jump into the deep pool of the bigger textbooks. You really establish a very good foundation, and this is one of the things that I find is often problematic, that there's a lack of basic and fundamental knowledge. So don't jump into the deep pool just yet. Medical statistics, obviously for calculations and things like that, those a suitable book would be useful. And then something to tackle biochemistry. So all those pathways, the metabolic pathways, the nucleic acid pathways, the glucose metabolism pathways, all of those, you need a basic biochemistry book to be able to deal with those. Although I do notice in the new Marshall that there's quite a lot of coverage of the of basic biochemistry. So this is basically, I think, quite. If you're able to familiarize yourself with this kind of material, you'll be in a very good position to tackle this exam. So this is the 8th edition, the latest edition of Marshall, and it's actually been published in 2017. I cannot recommend this book highly enough, because I've used every edition of this book since it first came out, and even when, I'm not sure if it was around, yes, it was around when I was a registrar. So the book has been through many iterations. It's excellent. I recommend it to every registrar in their first year, and it's really it will give you a good grounding in chemical pathology, as well as also prepare you for some of the other parts of the exam. So when we come to talk about the paper 2, the paper 2 has all these case scenarios case scenario questions in them. So in paper 2, the types of clinical scenarios that you're likely to get are the types of scenarios that will be similar or a similar standard to a book like Marshall. In other words, no one is attempting to give you a difficult clinical scenario, because this is a part 1 exam. So the clinical scenarios will be typical clinical scenarios that are common, that you would expect a first-year registrar to be able to tackle for the exam. Now, given that, I would say that most registrars would be ready for this exam after 18 months of training, even though the regulations say you can do it after 12 months. If it happens to be that you are of the caliber that you can do it after 12 months, then you are allowed to do it. But I think that in most instances, people will probably go through 18 months of training before they feel comfortable taking the exam. So coming back to the part 1. So the paper 1 of the part 1. So the paper 1 of the part 1 is going to look at how you integrate basic biochemical knowledge with chemical pathology. In other words, with chemistry, how you interrelate basic biochemistry with chemical pathology or clinical chemistry. And this is because as you go further in your training, when you come to the part 2 of the exam, examiners are less worried about how much basic biochemistry you know, because there's so many other things that need to be tested in chemical pathology, so there's less concern. So the expectation is that you would have done enough basic biochemistry in the first part of your training. Okay, so let's look at short answer questions. What are short answer questions? So short answer questions require explicit answers, not long-winded answers. They're not essay questions. You don't have to write short notes. They have to be highly specific. And so no marks are given for extra information. The candidates need to write short, concise answers. So remember that you won't have a lot of time to play with, so you just need to only give the information that's required in the question. And here are some examples of questions that would be typically associated with the short answer question paper. So, a man with mild jaundice, he's got a bilirubin of 45, no bilirubin in the urine, and the GP is wondering whether this would be due to hemolysis, but there's a question of Gilbert syndrome. So the question is the patient likely to have conjugated or unconjugated hyperbilirubinemia? So the answer is unconjugated hyperbilirubinemia. Very specific answer. To list 2 routine tests that I've used in exclusion of hemolysis. So here, answer haptoglobin LDH, so 2 marks, 2 responses. What might be seen on blood microscopy, indicating increased erythrocyte turnover. So obviously increased reticulocytes. List 2 factors that exacerbate the mild hyperbilirubinemia of Gilbert syndrome: fasting, illness, like a viral illness, menstruation, exertion, and alcohol. And what is the genetic cause? Here, there's actually 6 marks given for this one. Obviously, it's quite a long answer. UDP-Gal transferase gene promoter region Tata polymorphism. And then the question on diagnostic performance of genetic testing for Gilbert syndrome. More examples here. Name the fecal protein that provides the best discrimination between pancreatitis and malabsorption, elastase. So it's a very specific answer. It's asking you to name something. Name the chromogen used in the Jaffe reaction and the pH range in which the assay is performed, alkaline pick rate. So you would have needed to know, as I've said, the exam is also going to test technical knowledge as well, a technical knowledge that you would expect from this level of training. More questions on what is the term kinetic, explain how the kinetic method overcomes interference, adaptation of the Jaffe assay that's designed to minimize bilirubin interference, some questions on diabetes, and here a question on the LDH assay, plasma lactate measurement and what wavelength it's going to be measured at. So obviously some technical knowledge of this is going to be required. And then here are questions on what constitutes a reagent blank. So you need to have had some training in that aspect. Okay, so I mentioned extended matching questions. So these are also referred to as R-type questions. So the way these work is that, for example, here you've got a series of 16 options here, and for each scenario below you have to choose the most appropriate answer from the list above, and you can use each option once, more than once, or not at all. So in other words, not every option needs to be used. So here you've got these 5 scenarios, so you have to look at these scenarios, and obviously you can we won't discuss the answers, but you can replay this when you wish and find out the answer. So 3-week-old male seen by a pediatrician with severe jaundice that appeared at birth and has been worsening ever since. So from these you have to pick out the most all the things that are going to be related to this, either from the enzyme deficiencies, the syndromes, and other conditions that are listed there. Here's another example. You've got a set of results, so sodium, potassium, urea, and creatinine. You've got 3, 6, 9, 12 sets of results. You have to look at those results and relate those results to the clinical scenario that's listed. So that's another example of a extended matching question. So now, more examples of short answer questions. List 2 methods for measuring sodium. So very specific answer. You just need 2 options, 2 answers, 2 things that you need to list down. List 2 endogenous compounds which can interfere with creatinine measurement. What is the reagent used in the chemical method for measuring creatinine? List 2 methods for measuring protein in CSF. If a solution of compound appears blue, what color light is it absorbing? Which of the enzymatic methods for measuring glucose forms a basis for a reference method? What is the effect of temperature on enzyme reactions? Name 2 components of a spectrophotometer. What's the equation between describing the relationship between absorbance and transmittance? What's the equation for the Beer-Lambert law? Give 2 methods for measuring HbA1c. So these are all examples of short answer questions where the answer is very specific, it's very short, and remember that this method of testing also allows one to test a wider diversity of knowledge of the candidate, and also makes it easier for the examiners to mark as well, because you've got very specific answers. So the classical MCQ, which can also appear, the classical MCQ, the single option answer, or if there's more than 1 option required, then the question would usually tell you that. There's no negative marking being employed in any of the MCQs. So that's something to also bear in mind. Okay, so here are more examples of short answer questions. For example, here, list 3 causes of hyperammonemia in an infant. What's the pathway shown below? And then in the diagram below, write the names of the enzymes. So now, you can see that there's going to be a fair amount of biochemistry knowledge required, which is why, as you can see, that is listed in the curriculum, so it needs to be dealt with. Here's another example of a scenario where, based on the clinical laboratory findings, you have to suggest an outcome. 2 causes of conjugated bilirubinemia in the newborn. List 2 causes of hypercalcemia in infancy. Here's an OSPE type question that you can get with a microscopy picture of a urine sample. Here's another a biochemical pathway. This is another example of a type of question that could be designed to test diagnostic chemistry knowledge. And here's another example of the matching type of question, where you have to match the items on the left with items on the right hand side. So before we conclude with paper 1, I want to show you other types of questions that may appear. Here's an example of a question. What is the reaction shown here, and what is the enzyme involved? Now, this is a fairly common condition. Well, it's I would say it's part of common knowledge that one would expect. And then the next question here asks you to say what the compounds are. And so these are 2 common compounds. You have to understand this one is a common analyte, and this one is another a biomolecule. You can just by looking at the structure, if you understand the structure, you can guess what it is. So we've looked at the paper 1 of the part 1 exam, the MCQs, the short answer questions, and the extended matching questions. So I've shown you examples of all of those and the types of things that you are likely to encounter. I'll give you more examples of other types of short answer questions as well in the next part, so that you can get a greater idea, a wider idea of what types of questions you're likely to encounter. So now we'll get on to paper 2. So the second 3-hour paper, which we said is going to have cases, calculations, and OSPEs. So we'll look at the types of cases that you can expect. So here's an example of a case scenario that you can expect. Now, the best way to prepare for this is going to be from your general laboratory training in the clinical lab and the exposure that you're going to get to authorization of results. So you need to take an interest in all the results that you're authorizing, and if there are any unusual or weird results, you need to investigate those. And then secondly, you need to also look at material. So this is an example of a case scenario from the latest Marshall. And so that's a typical level of case scenario that you're going to expect. And as I've said, you would have come across many of the scenarios in your training. Here's another example here of a woman with tiredness and malaise, and you've got some electrolyte results that are unusual. Another example here, scaffolder with muscle weakness. You've got some laboratory results there, and you have to comment on them, and obviously the comment is provided for you from the book. So these are just typical examples of the types of things that you are likely to expect. If we go through other examples, yeah. So if you've actually going through the little Marshall book, it has so much information in it. You will pretty much cover a lot of things. So here's an example of a suspected porphyria scenario that is presented, and you have the case history, and you have the laboratory investigation. Okay, so now we're going to look at the other parts of paper 2. We've looked at cases. Let's look at calculations. What types of calculations are you going to need to be able to do? So here are some examples. A simple half-life calculation, a volume molarity calculation, mean standard deviation calculation. This one here is actually quite an easy one to do, but somehow people seem to get stumped by this. Even though we don't use BUN in South Africa, it's used in the USA, and there are lots of publications that use that. So it's a very, very simple calculation to do. This is an example of a simultaneous equation. Now there are certain types of calculations later on that would require you to know how to calculate this. Here's another example of a different type of calculation. And then another one here, calculate the molarity of water, very straightforward one to do. And then some absorbance calculations. So these are typical examples of what you can expect. OSPEs, here's an example of an OSPE. There's a quality control chart. You're asked to comment on the graph below and to describe what you see. Here's another one in the diagram below. Match accuracy, precision, good accuracy with the 3 graphs. And here's another one here. Now, this is a restriction digest. So it's basically a partial digest in lane A and a partial digest in lane B. And the question says, the diagram shows a restriction enzyme digest of the same DNA for different times. So A is a partial digest and B is a full digest. And so from that, you have to try and draw the restriction maps. In other words, using your understanding of how DNA is cut by restriction enzymes, figure out where the restriction enzyme sites are based on the picture of the gel. So that's a typical example. So those are examples of the types of questions you can expect in paper 2. So I hope that has given you a reasonable idea of what the exam will entail. And if you have any more questions, you're always welcome to get back to me.